So when somebody comes in for their diabetes and they're struggling, their numbers are totally out of control, and we tweak their medications, and they go home and they come back a couple months later and things are worse, instead of saying, why didn't you change, or what happened? We really kind of step back and think about what else is going on in this person's life that might be impacting their ability to control their own health.
I think the basic model is that this is an integrated system. We try to look at the whole person. We recognize that not only do people need medical care, but they also need behavioral health. They also need dental care.
I think at First Choice, because there's such an emphasis on community wellness, that even though we may be seeing patients, one-on-one, I think we are also still factoring in maybe their experiences as part of their family and as part of their communities, and as part of the city and even state. And so that focus on community wellness, I think, allows us to think in a larger picture.
So the number one thing, because I did private practice for 7 years, so it really feels like this is a community, just like the title says. I love that there's other services here on the campus where there's women, infant, and children. We have the health department, so if we need family members, because with kids, the Vaccines for Children program, they're covered all their vaccines, but sometimes family members need vaccines and they can go over to the health department. I love that the dentist is right here, so we can refer patients to the dental. And that's pretty amazing, because in other places we used to have to try to search for places for people to go.
So we get to work on little things in the clinic to transform, and probably the clearest example of that would be our project to start screening patients systematically for social needs. So when they come in, just when we're doing their vital signs, asking them about poverty, asking them about education, asking them about whether or not they're experiencing violence in the home, so that they can really give us a much more clear picture right when we walk in the door of what's going on in their lives, and then more accurately kind of form a plan together about what we're going to do to help them along their journey to improve their health.
We recognize that not only do people need medical care, but they also need behavioral health. They also need dental care, and we try to be comprehensive in what we do. We work as a multidisciplinary team, so we have physicians, nurse practitioners, physician's assistants, nurses, MAs, who all can work as a team. And not only that, but we really take into consideration what's going on in our communities. That's why we're called a community health center. We look at what's the need is of that community and try to address it in the best way that we can. If we're not able to, we try to partner with people, other organizations, to be able to meet the needs of the people that we serve. So it's unlike other types of primary care where you're just basically providing medical care. We provide comprehensive care, and we work with the people in the community to try and address the needs of that community.
And then that's allowed us to then bring in other team members who are experts in that, because I'm not an expert in that. I have a personal interest in that, and I think it's really important that we're asking those questions. But I also don't have time to be making calls all over town or figuring out who's working on all those things. So we've now incorporated community health workers onto our teams, who are just amazing human beings, first of all, but second of all, really experts at connecting people with resources that kind of respond to what we're learning that's going on in their lives. So
the community health workers have a very important role in Project Renew, as well as First Choice as a whole, and they are offering resources to patients who may be in need of employment, housing, food, help with applications. And because we know that if patients don't have some of those needs met, improving their health becomes very difficult.
if we really view health in its most broad form as really incorporating the social determinants of health and all of those things, what might be our responsibility to actually change the opportunities for health in our community, and really changing the built environment, changing when people walk down the street, how their health is impacted. So I think all of those things we're able to think about and we're able to work on, because that's how, from the top to bottom, we all view health. I think it's really inspiring, and thinking about what, now 5 years later, what brought me here, it was very inspiring for me to hear the leader of a healthcare services organization say that health is more than just healthcare services. And I think most people understand that at this point, but it's pretty brave when that's like your whole thing, to say it's more than that. And we have to step beyond that if we're going to really be true to improving health and wellness in our community.